Welcome to Lesson 5, Hints for Success in Implant-Guided Surgery. By the end of this lesson, the participants will be able to identify 10 very important details to achieve the success in guided surgery. The guided surgery technique is composed of many steps that can influence the final results. For starters, we will give you 10 hints to achieve success. Details make perfection. First one, measure the mouth aperture. This study published in 2024 measured the amount of mouth opening necessary for a fully guided surgery. In a stromal guided surgery, the total height needed to fit the contra-angle head plus the drill plus the handle plus the guide is about 40 millimeters. This study shows that, especially in the molar region, only 45% of the patients have enough mouth opening for a stromal fully guided surgery. And this percentage decreases in patients above 55 years old. So please measure the mouth opening minimum 40 to 50 millimeters. Second tip. Do the CPST with lip retractors and always full arch. You can use the cotton rolls in the vestibule to keep the cheeks away from the gingiva. This trick will generate a better CPST image in which you can access the soft tissue thickness and also allows for a more accurate merging with the intraoral skin. Third, spend time with planning. This is one of the most important steps in guided surgery, so plan it carefully. Pay attention to the details. Fourth, whenever it's possible, work with a security margin. Since we know that even fully guided surgery is subject to deviation, keep a security margin for important anatomy structures. Fifth, always check the implant position step by step. If you are starting guided surgery, always check the implant position with a depth gauge. This is crucial to validate your guide by checking all the steps. Especially in a flapless surgery, please check if the implant is inside the bone to avoid peri-implantitis. 60. Have a plan A and a plan B. Sometimes when you start new laboratory, new techniques, new procedures, the time between the guide manufacturing and the surgery, things can go wrong and the guide might not fit in the day of the surgery. Ideally, try the guide into the patient's mouth before the surgery. But in case this is not possible, have a plan B. Perform a cast-guided surgery. 70. Master to do the freehand way first. Develop skills to finish the surgery without a guide, if needed. 80. During drilling, enter passively into the handle and the guide sleeve. If you are struggling, there's a chance you might be in the wrong position. Create an angular deviation. Pay attention to the proper irrigation to avoid overheating the bone. Do an in and out movements until you reach the top of the drill. 90. Use a skeletal anchorage to stabilize the guide when the teeth support is not adequate. And then, never give up. Guided surgery is a learning curve in which you perfect step by step working together with a laboratory, so it takes time to adjust the details and master the technique. Be patient, it will be worth it. Thank you very much for your attention. See you next lesson.